Is Elizabeth German, and this is Medical English in Use Medicine from chapters 14 to 23. Okay, complete the table with words from C opposite. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Exhaustion, exhausted. Fatigue, fatigue. Lethargy, lethargic. Tiredness, tired. Make word combinations using a word from each box. Complain of color, out of sorts, present with, put on, worn out. Complete the sentences with the correct form of the verb present. A 67-year-old man presented with a 9 months history of increasing shortness of breath. The most common presentation of is loss of consciousness. Cranial arthritis may present as fever without any obvious causes. The patient usually presents with a severe sore throat. The presenting symptoms in this patient could perhaps be due to renal failure. Other conditions with similar presentations include acute cholecystitis. Reduced, reduced growth is an important presenting complaint of celiac disease. 2 months following presentation, the patient was able to walk. Read the patient's description of her symptoms, then complete the case report. I was well until a few months ago. In the beginning, I just felt off color and bit tired. But lately, I've been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I put on 9 kilos in the last year. My emotions are hard and my hair has started to fall out. Case 13. A 50-year-old housewife who had been well until 4 months previously, complaining tiredness and malaise. She had gained 9 kilos in weight in the year before she presented to her GP. Although she denied eating more than usual, she was constipated and she noticed that her hair had started to fall out. 15. Find words in the box with opposite meanings. Adequate, inadequate. Unlikely, likely. Severe, mild. Rare, common. Sudden, insidious. For, against. Make word combinations using a word from each box. Bone marrow. Differential diagnosis. Insidious onset. Iron deficiency. Pernicious anemia. Progressively increasing. Vibration sense. Complete the sentences. Look at A, B, and C opposite to help you. A 39 years old man presented with a history of progressive abdominal distension over a period of 6 months. Blindness might be caused by vitamin A deficiency. The bleeding and purpura are caused by abnormal platelet function. The white cell count is normal, so we can exclude acute leukemia. The yellow color of her skin and conjunctiva is probably due to jaundice. There was a palpable mass in the right upper quadrant of the abdomen. Treatment is aimed at restoring fluid balance with adequate intravenous fluids. The anemia maybe due to increased red cell breakdown. Complete the conversation. Look at C opposite to help you. Professor, what is against the diagnosis of pernicious anemia on physical examination? The problem started quite suddenly, so it didn't have the typical insidious onset. He doesn't have any skin pallor, and he doesn't have symmetrical paresthesia or absent vibration sense, and I couldn't feel his spleen. What about his tongue? His tongue was normal and not inflamed or sore. 16. Label the diagram using words from the box. Look at A opposite to help you. Breastbone, collarbone, jawbone, kneecap, rib, shin bone, shoulder blade, skull, spine, thigh bone. Match the types of fracture with the description. Open. There is a break in the skin. Comminuted. The bone is broken into several pieces. Displaced. The broken pieces are separated. Grand stick. The bone is bent. It occurs mainly in children. Impacted. The broken pieces are pushed together. Complete the task with the stride. Reducing a fracture involves trying to return the bones to as near to their on the original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will unite, but it may go on malunion. 17. Complete the table with words from A and C opposite. They complete the sentences with the words from the table. Verb, noun, adjectives. Delay, delayed. Develop, development, developed. Distend, distension, distended. Fail, failure, failing. Nourish, nourishment, nourishing. Babies with the fetal alcohol syndrome may present a failure to thrive. Abdominal distension may be due to enlarged liver. Small amounts of alcohol in pregnancy can affect fetal development. Mortality from measles can be reduced by better nourishing. Delay in one or more of the milestones may be the first sign of disease. Complete the sentences. Look at A and C opposite to help. After sitting, babies learn to crawl and then to walk. A child who has started eating solid food has been weaned. The someone who is not very tall is said to be of short stature. The stages in a child's development are known as the milestone. A child who is beginning to develop sexually has reached puberty. Write the common English name on each disease using your medical knowledge. Enlarged parotid glands, mumps, difficulty opening the mouth, locked jaw, rash and enlarged posterior occipital nodes, German measles, paroxysmal cough with vomiting, whooping cough, papulas and vesicles, fist on trunk, chickenpox, cough and could follow by rash, measles, sore throat and rash, scarlet fever, shallowing joints and a heart murmur, rheumatic fever, fever followed by muscle weakness, polio, cough with stridor, croup. Complete the table with words from E, V, and C opposite and the related forms. Put a stretch mark in front of the stressed syllable in each word. The first one has been done for you. Inhibit, inhibition, produce, production, release, replace, replacement, secrete, secretion, estimate, stimulate, Stimulation. Complete the passage from a textbook using the illustration in your own knowledge. Pulse of GnRH, gonadotropin releasing hormone, are released from the hypothalamus and stimulate LH and FSH released from the pituitary. LH stimulates testosterone production from lady cells of the testes. Testosterone feeds back on the hypothalamus pituitary to inhibit a gonadotropin releasing hormone. Secretion. FSA triggers the Sertoli cells in the seminiferous tubulus to produce mature sperm in the inhibins and AMB. Inhibin cause feedback on the pituitary to decrease FSH secretion. Complete the sentences, look at A and C opposite to help. A diffuse change affects many parts of an organ or gland. A localized change affects only one part. His diet is deficient in iron. He doesn't get enough iron. Expressed T3 and T4 increase the basal metabolic rate. Match Mr. Davis' symptoms with the question her doctor asked. Diarrhea. Are your bowels normal? Eating more. What is your appetite like? Heat intolerance. Do you prefer hot weather or cold? Overactivity. Are you able to sit and relax? Palpitations. Have you ever felt your heart beating rapidly and irregularly? Weight loss. Is your weight steady? Tremor. Do your hands shake? 19. Complete the table with the words from the opposite and relate forms. Verb. Noun and adjective. Accommodate. Accommodation. Constrict. Constriction. Constricted. Converge. Convergence. Delay. Dilatation. Dilatum. Dilate. Drop. Dropping. Oscillate. Oscillation. React. Reaction. Match the pictures with the condition. Dropping of legs. Number 6. Delayed pupils. Number 3. Irregular pupil. 2. Cataract. 5. Squint. 1. Constrict pupils. 4. Complete the extract from the textbook. Retinoscopy. Examine the retina with an ophthalmoscope, if possible with the pupils dilated to obtain the maximum view. Look for papilloderma and for flame-shaped hemorrhages and cotton wool exudates. Access the state of the arteries and of the presence of any narrowing, as well as nipping at arteriovenous crossings. Complete the case report. Look at A opposite to help you. Physical examination revealed a thin girl with sliced pallor. She was not obviously dehydrated. The temperature was 38 grades. Pulse 100 per minute. Blood pressure 110 per 880. Examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was not distended and there was generalized tenderness, which was more marked in the right lower quadrant and was associated with guardians, but not rigidity. There was no rebound tardiness and no masses were felt. Vowel sounds were reduced. Match the description of the stools with the conditions most likely to cause them. Loose, bloody, ulcerative colitis, loose, pale, bulky, celiac disease, clay colored, obstructive jaundice, black, terry, gastric ulcer, small, hard, irritable bowel syndrome, clear, watery with mucus, color. Match the features to the doctor's question. Blood. Have you passed black stools? Bowel habit. How often do you open your bowels? Change in bowel habit. Are you going to the toilet more often than normal? Bulk. Is the size of the amount of the stool normal? Color. What about the appearance of the stools? Consistency. Are the motion hard or loose? Offensiveness. Do the motion have an unusual smell? 21. Write a simple English phrase for each of the medical terms below using your medical knowledge. Hysterectomy, surgical removal of the uterus. Menorrhagia, prolonged menstrual period. Salpingitis, inflammation of the fallopian tubes. Cervical biopsy, removal of a small piece of the cervix. Read the conversation between a gynecologist and the patients in the opposite. Menarche, about 12. Menstrual cycle, every 4 weeks. Last menstrual period, a week ago. Menorrhagia, light. Dysmenorrhea, not really. Discharge, a little, white. Now write the questions that the doctor asked. Menarche, how old were you when you started to get them? Menstrual cycle, are your periods regular? Last menstrual period, when was your last period? Menorrhea, do you get clots? Dysmenorrhea, do you get period pains? Discharge, is there any discharge between the periods? Complete the case report. One word is needed twice. For a 5-year-old woman have been having heavy periods lasting for 8 days, with the passage of clothes for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flush or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously when a copper coil was fitted. She had a she had had a normal pregnancy when she was 25. 22. Complete the conversation based on the case history in the opposite. Doctor, what seems to be the problem? It's been getting palpitation. I've been getting palpitation. How long have you had them? For about 6 months, but I've had hip problems for years with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I had, I had to sleep on 3 pillows. I had a mitral valve replacement 3 years ago, and that improved things for a while. Make word combinations using a word from each box. At rest, atrial output, cardiac failure, heart, cardiac outputs, heart failure, on effort, beating or edema, premature beats. Write the words a patient will use to describe the symptoms below. Dyspnea, shortness of breath, arrhythmia, palpitation, orthopnea, dyspnea when lying flat, edema, swelling, welling. A 60-year-old woman attended her GP surgery complaining of breathlessness, on exertion. This had been increasing over the previous 8 months until it was producing problems at around 500 meters walking on the level. There was no history of chest pain. She had had several episodes of fast palpitation, which last to 20 to 30 minutes and were associated with some shortness of breath. She had noticed some swelling of her ankles by the end of the day. This disappeared overnight. 23. Complete the table with words from neighbor opposite. Put a stress mark in front of the stress syllable in each word. Auscultate, auscultation. Examine, examination. Inspect, inspection. Palpate, palpitate, palpation. Percuss, percussion. Put a step for examining the hair in circulation in order. 1. Look for clothing. 2. Feel the radial pulse. 3. Measure the heart size. 4. Locate the apex heat. 5. Note the any thrill. 6. Are there any murmurs? A doctor is presenting the case of a 43-year-old woman at a meeting in the cardiology department. Complete the test of her presentation. On examination, she was pyrexial with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and force. Her blood pressure was 130 per 80 and her GVP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulse were all present and there was no central or peripheral cyanosis. Her apex beat was displaced to the anterior axillary line but still in the fifth intercostal space. Her heart sounds were very interesting. When she was initially examined, it was noted that she had pansystolic and mid-diastolic murmurs, heard best at the apex. When she was examined some hours later, there was a harsh pericardial friction rub all over the pericardium. Our diagnosis at the time was of mitral stenosis and incompetence with a resonance of pericarditis and atrial fibrillation.